Welcome to Connected by Health. I'm Dr. Krishna Vedala. This is where medicine meets leadership, innovation, and humanity with one goal: to add value and help change healthcare for the better. If you believe health is about more than a diagnosis, you're in the right place. Welcome to Connected by Health. Today we're exploring one of the most debated topics in American healthcare, the idea of a national healthcare program here in the United States. With healthcare costs continuing to rise and millions of Americans struggling to access affordable care, many are asking whether a public finance system could improve health outcomes, reduce administrative waste, and ensure coverage for everyone. So whether you're a patient, a provider, a physician, a policymaker, or simply someone just interested in the future of healthcare, this conversation affects us all. So join us as we examine the potential benefits and real-world implications of a national healthcare program in the United States with Dr. Philip Verhoef, who is here today to answer some of our questions and also give us a little bit of explanation about what a national healthcare program here in the United States would look like. Thank you so much, sir. Thank you so much for being here today.
Yeah, I'm really happy to be sitting down and chatting with you about this.
Awesome. Can you please tell us a little bit about yourself and what inspired you to advocate for a national health program here in the United States?
Sure. So I am a Med-Peds intensivist. So I basically trained in my residency for internal medicine and pediatrics, and then became boarded in adult ICU as well as pediatric critical care. And I work in Honolulu, Hawaii. And so that's my clinical practice. But my interest in advocating for national healthcare actually dates back to my days in residency. I was sitting in a residency noon conference, and the speaker that day was one of our faculty. And he presented the arguments for a single payer system. And as he was talking about how expensive our American system is and, what the promise might be of a single payer, I was blown away. I couldn't believe what I was hearing. It just sounded fantastic. And so, have you told people about this? This sounds incredible. And of course he laughed and said, of course. And, and it turns out, of course, that the forces in this country have been fighting against this actually for decades, really since the 50s. And so, it was at that point in residency that I started to think, maybe I need to start advocating for something like this. And I actually was hopeful that we would have that leading up to Obama being elected, because it was clear that Obama had been on record saying that he believed the single payer system was the right way to go. And so I started to get active with organizations promoting Obama as the next president. And so I was really excited when he got elected. But then when I saw what the Affordable Care Act was becoming, I said, nope, this is not for me. I appreciate that the Affordable Care Act expanded healthcare coverage for millions of people, but it still left 30 million people without healthcare insurance. And perhaps the more important problem I had with the ACA was that it mandated that people buy a commercial health insurance product. And so, of course, this was actually a boon for the private insurance industry because they become more entrenched in our American system. And so at that point, in 2011, I moved squarely into single-payer activism and began getting active with Physicians for a National Health Program, which is a physician-led organization that advocates for single-payer healthcare in this country.
And that was actually my next question. Can you tell us a little bit about Physicians for a National Health Program? Could you give us a little bit more detail about what it is that the Physicians for a National Healthcare Program is trying to do specifically?
Yeah, absolutely. So Physicians for a National Health Program was formed in the late 80s, actually, by a group of physicians who looked at the healthcare system we had and said, there must be a better way. Why do we have so many uninsured patients? Why are we spending so much money on healthcare? Why are we having such a difficult time covering everyone? And so the organization was founded then and has since been fighting for a national single payer system. And so we're going on 40 years now that this organization's been around, which is kind of remarkable. I once spoke with some of the folks who founded it and asked them, what did you think when you were starting this? And they said, well, we certainly didn't imagine that that it would take us more than 40 years to get the kind of healthcare system that we need. We thought that this would be easy. We'd get out there, some doctors would organize, we'll tell people, what the right solution should be, and folks will listen, and then we'll have it. And, we got close over the years. I think in the early 90s, Hillary Clinton tried very hard to reform the healthcare system and guarantee coverage for everyone. But of course, that did not succeed. And so since then, we've seen the rise of the HMO. We've seen the rise of private equity. We've seen the rise of ACOs and Medicare Advantage. And we've seen privatization of state Medicaid programs, where most of the Medicaid programs in this country are administered actually by private insurance companies that contract with state governments. And so what we've seen since the formation of PNHP is actually moving in the wrong direction. More and more healthcare delivery and healthcare coverage is coming through the private sector. And I think what you have to remember is the private sector has really one thing that is their primary priority, and that's to make money. It is not the health of its people. It is solely shareholder profits. And when you realize that that's their sole motivation, you realize that it was absolute folly for us to put our entire healthcare coverage system in the hands of those folks. As much as they might try to say that they do care about people's health, at the end of the day, they don't. And so what that means is that for 40 years, has been trying to educate physicians about what this means. We've been trying to educate lawmakers. A big part of what we've done has been research, where we sort of document the healthcare inequities that arise as a function of this profit-driven system that we have. It's partnering with allies, other organizations who also believe that healthcare is a human right, that it's a fundamental, part of our living in America, that everybody should have access to this sort of as they do everywhere else in the world. And so much of what PNHP's work has been to organize physicians to stand up and fight. I think one more thing that I would say is that the reason that we're in this position that we're in the United States is because physicians have forgotten to speak up, or they've neglected to speak up. This problem happened because we stopped taking control of how the healthcare system functions. We have ceded that power to private interests, to business interests, who are going to seek a way to make money at it. And so I think until physicians start standing up and saying what they believe and speaking out and saying, this is not acceptable anymore, I don't think we're going to see change. So I think a big part of what I do is to try and inspire docs to speak up, to become active in advocacy and fight.
Mhm. Well, no, thank you. Thank you for explaining about the program, but also about really talking about why it's important for us to really look into a single payer system down the road. Because you're right, when Obamacare came out, I felt even today looking at it, I think the intention was there, but I think the political, I guess you can play role playing, or just the making all every stakeholder happy, whether that's the insurance companies, the pharmaceutical companies. I feel like a lot of that really got in between. And in one way, ever since Obamacare has passed, there really hasn't been any other major healthcare initiative, even on by the Republicans. Yes, there was some kind of a framework, I guess, if you want to call it, but it's never really been put into action. It's never really been put into in a long form bill. So I think the issue is I feel that the appetite was there when Obama came in, and I feel that perhaps what happened was just the political machine was just so against it. It was sort of a compromise. And unfortunately now the problem is that the compromise is only leading to increased healthcare costs and more people being burdened financially by healthcare. And of course, it's not that the opposition has made it easier by whether if it's the Medicaid expansion or lack of Medicaid expansion, and whether if it's not paying for the premiums. Therefore, a lot of people on Obamacare now are probably going to get kicked off, or already have been kicked off. So there's a lot that's just working against the Obamacare from the beginning, and even the idea and the hope that we had when Obama's presidency started, I feel like fizzled pretty quickly. But one of the things that they were talking about, and I remember pretty vividly during that debate, was a public option. And so I was wondering if you wouldn't mind kind of talking about what the differences are between Medicare for all a single-payer healthcare system and a public option?
Yeah, no, I think it's a really important question. And so I think I'll start from the sort of most pure form of a single payer healthcare system is that there is a single government run health insurance program that covers everybody. And when I talk about a single payer, that is that means that, when a physician provides care for a patient, they would get paid for that care via the government insurance system. When a hospital provides care for patients, it's the government insurance system that pays for that care. And this is the kind of system that exists in a number of different countries. Places like Canada has one. But it is a little bit different, and I want to be a little bit clear. A nationalized healthcare system, which is sort of what the UK has. And it's a bit like our VA system in the United States. And in that context, all the physicians and the hospitals are actually owned by the government. So, if you're a VA physician, you're a federal employee. And that's not really what I'm talking about in this context. I'm talking about, a pure single payer system being one payer, hence the single payer, but the delivery of healthcare remains private. You don't have to be a government employee. Now, when people talk about Medicare for all, that can mean a lot of different things. And that's a thing that the movement struggles with. And people don't know, does that mean Medicare in its current form with A, B, and D? Does it mean Medicare Advantage for all? What does that mean? And I think the devil is in those details. Some people, when they talk about Medicare for all, they really just mean a true single payer, but others are imagining that it's aspects of the system that we currently have. And this is a messaging problem that our advocacy has. So for me, what I like to talk about is an improved and expanded Medicare for all. So I talk about improved Medicare for all because let's look at all the problems in Medicare right now, right? The problem is, if you have traditional Medicare, you don't have a cap on your out-of-pocket payments. You don't get hearing covered, vision covered, dental covered, long-term care. These things aren't part of that. And so people with Medicare still have to buy supplemental Medicare plans just to protect themselves from financial insolvency. That's not the system that we want, right? We want a system where everything that you need gets covered, that medications get covered, hearing, vision, dental, all of those things get covered, that you are not at risk for financial catastrophe when you get sick. And so I think that improved part has to do a lot of work. We have a lot of improving of the current Medicare system. But all that being said, the system still works much better than the private insurance system because if for no other reason than 98 cents of every dollar of revenue to the Medicare system gets paid out for medical care. But if you're talking about private insurance companies, it's more like 85 cents of every dollar of revenue is for medical care. That other 15 cents per dollar is used for profits or advertising or maintaining the administrative bureaucratic structure that they have. And so this is, I'm really fighting for Medicare, which is a program that everybody understands, but I want it for everybody, and I want it to be much better than the way Medicare is currently structured. Now, when people talk about a public option, the idea is, hey, why don't we just let people buy into the Medicare system? If Medicare is so great, people might want to do that anyway. And, and we should sort of incentivize that. And maybe that can be a way that we get to a single payer system, because if everybody buys into the public option and then all of a sudden, commercial insurance companies see that, people are leaving them and going to the government systems, then they say, well, maybe we're just going to have to close up shop or it's a competition that they can't win. And then perhaps we'll get there. I think that that's a little bit naive. And I think one of the problems that I have with the public option argument it hinges on this. Our current healthcare system is so complicated because any doctor has to contract with lots of different insurance companies. Any healthcare system contracts with lots of different insurance companies. Each of those companies has their own rules on prior authorizations, on what can be covered, on what medications are on formulary. And that creates an incredibly complicated administrative network, right? That administrative work that people have to do to fight prior authorizations, to try and get, to figure out if a doctor is in their network, to get the right medication, that system eats up hundreds of billions of dollars and frankly, doctors' time each year. And so if we just add a Medicare public option into that, that doesn't simplify our system at all. We still have all of those commercial players out there. We still have the incredible administrative complexity. And yes, maybe we have a better insurance program that will cover more, or that you can take with you when you change jobs. Because of course, right now, when people stay in a job, they do it because they can keep their insurance, which is also incredibly awful, right? So
Yeah.
I think a public option doesn't solve that administrative complexity that I think is such an underpinning of the American healthcare system. I think the other thing that I worry about with a public option is this. Remember that a commercial insurance company, they really want healthy people, right? They want to, what we sometimes call it cherry picking. They want to cherry pick the healthiest people and lemon drop the people that are sick. Why? Because if a patient is more sick, then the insurance company has to pay more for their care, and therefore they lose money. And so I worry that if we introduce a public option, we're going to see all of the sick patients being forced onto the government insurance programs, and all of the healthier patients moving to the private insurance programs, because of course those private insurance programs will offer gym memberships, or they will incentivize ways to get healthier people there, right? Maybe those private companies, private insurers won't cover super expensive medications, right? And therefore they avoid patients that have diseases that are treated with super expensive medications. And so, I worry then that we will create this dumping of sick patients onto the government plans, healthy patients in the commercial plans, and that becomes really expensive for the government to shoulder. Because if you remember, the whole principle of insurance is risk pooling. The idea is a bunch of people get together and they all pay some amount into the system. And then when one of those people gets sick, that money that everybody pays in covers them. But that system depends on having both healthier than average people and sicker than average people in it in order to work well. And so, of course, in my mind, I'm like, well, why not a risk pool that has 330 million Americans in it, right? Let's have the entire country in there. And then you'll have all the 20-somethings who, act like they're 10 foot tall and bulletproof and never go to the doctor, but they don't use the healthcare system very much. They're paying a small amount into it in the same way that everybody else that is sicker pays into it too. Then when people do get sick, there's that money to pay for their care. That to me is the most sensible way to sort of manage risk, is to pool it across everyone instead of creating pools of very healthy people that the insurance companies want and a pool of very sick people that gets dumped onto the government-run insurance.
Mhm. Well, I think one of the, obviously the term that always gets thrown out there is socialization or socialized medicine. And then, of course, the question I always ask myself is, what is Social Security? Is that not socialism, right?
Totally.
Because, I mean, at the end of the day, a great number of our population, a great percentage of our population relies on Social Security. And if we don't want socialism in general, maybe we should just go to Social Security at the end of the day, right? And I'm pretty sure a lot of those people will be upset, and I get it and I understand. But I think the issue is when, and then this is, I live in Oklahoma, which is a very conservative state, and 50% of the country probably lives in a very conservative environment. And I think that's the concern that is always, well, we don't want socialized care.
Yeah.
We already kind of have that with Social Security. But in terms of like taxes and the payment, specifically the funding for either Medicare for all or single payer, and how would that really work? And would we really be seeing any more than we're theoretically spending? Because the way that I say this is, people are now paying probably higher premiums anyway, and why not just take that money, add it into your taxes, and then just leave a system that's much more simple rather than something that's much more complex and that has greater capacity for corruption, specifically financial corruption by some of these bigger corporations.
Yeah. No, I think you've exactly nailed it there. And so there have been several, the Congressional Budget Office, but also independent economists have actually run the numbers on this, where they would sort of model, all right, let's do this. Let's have a single government-run system that covers everything: hearing, vision, dental, all healthcare, inpatient, outpatient, reproductive care, you name it, it's going to be covered. And there will be no out-of-pocket costs at the point of care. You're not going to have to show up and pay a deductible. You're not going to have to pay a big copay because, of course, these are just tools to keep you from using care, right? So let's model this. A system that does all of that and covers all of that for you, that can actually be achieved if we simply do what you just said: redirect the money that we pay in premiums into the government coffers. We can actually cover everything with no risk of financial calamity, when or no choices to make where you say, gosh, am I going to pay for my medications or am I going to pay for my food, right? And so this has been well modeled at this point, and it's totally doable. And in effect, what it means, and in fact, like 95% of Americans would pay less in taxes under a system like that than they currently pay in premiums. So it would actually mean more money in people's pockets and the guarantee of healthcare, right? No longer being locked into a job, no longer having to worry that you're not going to be able to see the doctor that you want to see when you get sick. No longer needing to make those choices between drugs and food and rent, right? And so it's remarkable that we already pay enough. It's just that we would be cutting out that 13 cents per dollar that gets taken up by the private insurance industry and simply redirecting it to creating care for people. Now, so we can do it. We have paid enough, and it would probably be funded through a progressive taxation system where, people that have less pay less into the system, people that have more pay more, and this can be done. I think that's the most important lesson to put in there, is that this can be done, and it would make everybody's lives so much more smooth. Now, obviously there are a lot of challenges with that, because if suddenly everybody had health insurance, suddenly everybody's going to start needing to see the doctor, right? They're going to be able to go see the doctor because, they've been putting it off for all this time because they couldn't afford it, or they'd already reached their, the maximum that they could spend and what have you. And so, with the implementation of a single payer system in this country, we also have to do some serious workforce development. It also means really allocating resources for care where care is needed, not just where the doctors are, right? So if you're, name it, you go to Chicago, right? I used to live in Chicago. We had 4 hospitals that would do congenital cardiac surgery on children. I don't think Chicago needs 4 hospitals that do that, right? That they're all competing with each other constantly. Instead, you actually create infrastructure where you don't have such a concentration in certain places of doctors and then no doctors out in rural America. Because that's a problem that we have. We have that problem here in Hawaii where I work. There are very few doctors on the neighbor islands that aren't Oahu, and that means people don't get care. So a big part of a single payer system is also that we direct resources to where they are most needed, not just where people want to live or, where people are, right? Which is currently how things work. And so, I think if we implement it, we will see that everybody will have access to care. That's unquestionably what we want. But we also need to build a system that can handle everybody being able to access that care. So I think it's not, it's creating the national health insurance system, but it's also reframing how we think about healthcare delivery. Right now it's subject to the whims of the private insurance industry, or how can people make money, or private equity going in and buying out practices and then turning around and selling them and closing hospitals and what have you. Everybody's trying to extract their dollar from it. But the fundamental for me is that, healthcare shouldn't be a profit opportunity. Not in general, right? I mean, this is just not right.
And please correct me, but I think in most parts of the world, specifically in Europe, I mean, health insurance, Germany has found a way to still have private, healthcare, without the necessity of a single payer system. I think they do it by, is it guilds is what the term is? You have different guilds that are based on, to some degree, on different employers. But But in those countries, health insurance companies are legally required to be nonprofit, correct?
Exactly. They're highly, highly regulated, right? They are
Hmm.
regulated in a way that I cannot imagine our insurance industry would tolerate, right? If we told every single insurance company, you need to offer the same set of benefits to everyone and at the same cost, and, and the only way you can compete is just for sort of the icing on top, or the cosmetic things, or other enhanced services that people might like. Like, our insurance industry is never going to go for that. So I don't see the point in trying to preserve a multi-payer system where we regulate the heck out of the insurance companies. To me, they're still always going to have a desire to make money, and if not, they're going to get out of the business. Like, I don't I to me, we kick them all out and create, in effect, a government run health insurance company that's accountable to the people, right? That is responsive to our needs and helps really assure that we can live healthy and productive lives.
Well, it is. It's not, obviously we can both agree it's not an easy transition by any
Yeah,
means, but I believe it is a necessary transition that we're gonna have to make because the current system is just one, it's not working. Two, we've been trying this for the last 70, 80 years, and it clearly is only getting worse, and our
yeah,
outcomes are getting worse. What
yeah.
would you say would be a disadvantage if we were just to choose, single payer or referral? What would you say would be just one disadvantage for the United States transitioning to such a system?
So I think people raise concerns about single payer systems. One concern is, well, we can't trust the government. And I don't know how to assuage that concern, right? We trust the government to make sure that the fire department comes when our house is on fire. We trust the government to make sure that the mail gets delivered on a regular basis, right? There are certain places where we can clearly trust the government. And so um, I think that's a hard one to fight. I think there's also the concern that this will somehow stifle innovation. So people say, well, a lot of the innovation that we have in this country comes from the fact that you can make money on the next blockbuster drug or service. Now, I don't think we have to assume that innovation's going to go anywhere. I think those opportunities for innovation will still exist. Will pharmaceutical companies struggle if suddenly the government can negotiate with them for the price, and similar to the way that the VA negotiates for the price of medications? Honestly, the pharmaceutical companies are doing fine. I don't think they're going to go out of business. And and I think that, this clearly can work in other countries. I don't think we have to assume that we give up on innovation. I think another thing that people raise concerns about is waiting times. People say, I hear about in other countries with national systems that you have to wait a really long time to get care for, getting your hip replaced, right? Or a knee replacement. And so people trot out the concerns of waiting lists and talk about rationing. And I guess I have an answer to that, right? If you have health insurance, right now, do you have to wait to get care? I could tell you yes, right? My mom, it was looking for a primary care doctor here in Hawaii, and the soonest that she could get one was more than 6 months away, right, for a new patient visit. And so people are already waiting for care. And let's just ask the question, what if you don't have insurance? Is there any primary care provider that you can see? Maybe if you can get into a federally qualified health clinic, right? And, what about within the county system if you need a specialist? What if you're diagnosed with lupus, but you don't have insurance? You're going to have to wait a year to see the docs at county. The same holds for cancer, right? If you don't have health insurance, you have to wait a tremendously long time. And that's just because you don't have health insurance. So we already have that kind of rationing. We already have those kind of waiting lists in this country. But the rationing is irrational. I call this irrational rationing because it's rationing based on your level of society, your level of income, the color of your skin, where you live, right? It's rationing based on totally irrational things that have nothing to do with your healthcare or healthcare outcomes, right? So I feel like we need rational rationing where, if you need care immediately because you're going to die, you're going to get it, right? Because that's the thing. If you talk to people in Canada, you have a heart attack, you don't wait for a bypass surgery, right? You get a bypass when you need to get a bypass surgery, and so it's prioritizing the things that are the most important for people. And if there are things that are not going to be life threatening, that you can wait a little longer, like this is how you rationally think about healthcare utilization under a national system like this. You do it, based on, real metrics like how is this going to help people? Are they going to die if they don't get this kind of care? And it's very clear that in other countries that have single payer systems, that you get the care you need when you need it. And, quite frankly, again, if you look at wait times in Canada versus wait times in the United States, a lot of times people can get care much more quickly there than they can here. Or here you have to find workarounds like going to the local CVS, which has employed, an APRN to sort of run an urgent care clinic. That's a lot different than you being able to see the doctor that you have a relationship over years. But doctors can't run those kinds of clinics anymore because, there's too many other pressures on them. So, I think that's another concern that's often raised about single payer systems. And the last thing I would say is I would worry that putting a system like this in the hands of the government means it's subject to the political whims of the government. I look at our current Secretary of Health and Human Services, and he's perhaps the least qualified person ever to sit in that role. And I'm not sure that I really agree with him on just about anything. And yet, if we had a single payer system, he would be sort of above that in the way that we've thought about constructing this. So, I also am very cognizant of that fact. And I feel like if we develop a national health insurance system for this country, its governance has to clearly be, one, led by physicians, two, doing evidence-based work as how they function, but three, somewhat immune to politics, right? You can't have somebody deciding that we're going to take away all the mifepristone, so now it's gone, right? Or we're not going to, we're going to make it so that vaccines are not mandatory anymore, right? This is not an evidence-based decision by any stretch of the imagination. So the governance of the national health insurance system cannot be subject to the crazy ideas of whoever is the head of the Secretary of Health and Human Services. And so I think the devil is very strongly in the details in how we build that governance for a system like this.
And you bring up a really important point just now, which is if this is government led, you really are at the mercy of whoever leading the government, and that is a frightening scenario. If you have part of the reason why I feel, although Obamacare was not perfect, but I think part of the reason why it failed even more was because there was always attempts to politically dismantle it, always attempts to get rid of what made it somewhat, I feel, a better option. And so now what we have is, and I don't think people say this often, and I think it should be stated, we have what's really a watered down version of what the initial bill really was.
Absolutely.
And that's the problem, is if you do have a national health insurance program and you have political ploys that are done just for the sake of making political points without really coming up with a concise alternative, you're just going to end back in disaster. And I think that's the scary scenario, and there has to be some kind of protection. But I also feel, when you said it has to be led by physicians, it has to be led by people who know what they're doing. And unfortunately, during this time, I just don't feel that that's really the case in a majority of healthcare. I feel that certain times that a lot of the decisions are made purely out of money, but not really out of the concern for patients and then the general population, whether if that is bigger health systems, just firing or removing entire service lines for the sake of saying, oh, well, we're trying to, stay steady, we're trying to stay profitable. And somehow the CEOs end up making $2 million bonuses annually. I'm not trying to blame one side or the other, but when you see these kind of things and you see some of the cuts that have been made, especially here I'm from obviously Oklahoma, especially here in Oklahoma, it is difficult, and it is very a very tragedy, or a tragic event to really look into. I think the last question I really want to talk about today, and I think this has already been stated several times, which is we want to do this in a different way here in the United States, and yet other countries are doing it in a very similar manner amongst themselves, and yet they all tend to have better healthcare outcomes. Why do you think that is? And why do you think that's often looked down on or not emphasized enough?
Question. You know, our healthcare outcomes are so much worse than so many other countries, and it's whatever metric you want to look at, whether it's infant mortality or life expectancy or outcomes for, various and sundry conditions. And so, I think the primary driver of that has been that we have a healthcare system here that regards the provision of care and so private insurance companies will always look at paying for healthcare as the last thing that they want to do. Their whole goal is to not pay for something because then they get to keep that money, or they delay as long as they possibly can. So they'll drag out approving that MRI, and then lo and behold, the cancer that was not metastatic is now metastatic, right? Or you've delayed being able to get the cancer chemotherapy that you needed, and now it's too late for those interventions to be meaningful, right? So I think you can lay the blame on our poor health outcomes on the fact that we don't have a standardized or systematic approach to healthcare access in this country. So many people don't have access to healthcare. They simply choose to go without, or they'll only go to the emergency department when they need it, and then they'll be saddled with a bill and have to file for bankruptcy, et cetera, et cetera. All of these decisions that people are making because we don't have healthcare have healthcare consequences, for their individual health, whether that's a shorter life expectancy or poorer outcomes for care. And so, I wish that the fact that probably 35,000 people per year die simply attributable to their lack of health insurance, I
Hmm.
wish that made a splash, right? Because that's a lot of people. And and we are, as a country, saying that's okay. We think that's okay because we would rather have this multi-payer, fragmented private insurance system as the backbone rather than a publicly administered one. And that doesn't feel right to me. And one of the things that I do think is important to mention is that right now there's no transparency. There's no transparency in anything that's happening in the healthcare industry because it's all in private hands, right? If we moved it into the public sector, we could at least try to create public oversight, to create transparency in the way that we do for all other functions within government right now. So it would empower us to actually make sure the system is doing what it's supposed to be doing and taking care of the people that it's supposed to take care of, because the government's interest isn't in making money. The government's interest actually would be in people being as healthy as they can be, because that's why would have a health insurance covered system like this. So, I would anticipate that our healthcare outcomes would gradually get much, much better as we provide healthcare more consistently for people, where people don't have to stay in jobs because they have pre-existing conditions, where they, don't have to avoid seeking healthcare or, split their insulin doses to make it last longer, right? All these kinds of things make our outcomes worse. And so it's sort of shameful that our healthcare outcomes are so much worse than everywhere else in the world, and yet we spend almost twice as much as anybody else in the world on healthcare in this country. So, to me, this is really the only solution. I don't see a viable alternative that keeps this multi-payer private insurance sort of profit-seeking motive involved in the game. It's just a question of, when is it going to get bad enough that we're all going to rise up and demand this as a solution? And I don't know. I don't know when we're going to hit rock bottom. This administration is rough right now, and I think a lot of us don't like working in it. A lot of us don't trust it. But and so in many ways, I stay in my lane, which is healthcare. But I could very well be out there arguing that we overturn Citizens United and get corporate money out of the influence of politics, right? That would be a very reasonable thing to do. Or maybe I should go out there and fight against all the crazy gerrymandering that's going on, that's
Right.
creating, a completely biased misrepresentation of Americans and therefore American wills. I'm not an expert in any of those things. I stay in my lane of healthcare because I think that there's a lot of work to be done here. But I also think that more broadly, we have to be thinking about creating a government that's actually more functional for us, and not one that is really hell bent on doing the least possible for people that live here.
Yeah. Well, I mean, that's you opened a Pandora's box there, specifically
No,
about regional gerrymandering. And,
yeah,
the thing I don't think a lot of people understand is when you destroy the voting power of a group of people who are already maligned, who already have worse health outcomes, now you're only going to exacerbate that. And that's only going to lead to increase further healthcare costs. So, and we're all paying for it. And I
yeah,
don't understand why people don't really see that. I understand if being in power is the desire, that I get, but being in power at the expense of not being able to win an argument and basically taking away the voting power of groups of people just because this is what you feel like should be done, or you're at the whims of a leader that you're intimidated by. But it is a concern, and it is really sad, and it is tragic. And exactly, you're right. Maybe we should stay in our lane, but unfortunately, I think the problem is everything is connected, and that's really what
yeah,
this podcast is about. Whether if it's
yep,
politics, whether it's education, whether if it's national security, whether if it's energy investments, these are all connected. And we can even talk about Bitcoin sometime, cryptocurrency maybe down the road, and then how that can come into play to really affect our healthcare. But those are always episodes further down the road. Just real quick. Do you think there is going to be some kind of appetite on a national level for change when it comes to 2028? Because we felt this way in 2008, really didn't
yeah,
go anywhere.
yeah.
I feel that in 2020 could have been an opportunity maybe, but that was clearly missed. And of course, now we're kind of dealing with a lot of unsurety, a lot of destruction of really the public health system in the United States. But do you think 2028 could be a year when there could be a national appetite for a national health plan or a national health insurance plan?
I do, for a couple of reasons. When people get out there and do their polling, you're seeing that the American public, more than ever before, believes that the government should be playing a significant role in health coverage. Whether they believe that should be through a single payer system or not, that question continues to pull better and better. So we're seeing more and more people who are identifying the root cause of the problem, which is private insurance sucks. Government insurance, maybe it's not great, but it certainly is better than this, right? And so I think you're seeing the public hunger for that, but I think you're also seeing healthcare, providers, clinicians, physicians. I think we are getting more and more fed up with the system. And so I think you're going to start to see professional organizations, groups that represent doctors, starting to push for this too. The American College of Physicians has come out and said, we support a single payer healthcare system as a solution to America's healthcare problems. They're the most progressive on that. But I think we're going to start to see other professional organizations following suit because this is unsustainable. It becomes the only option that's left. And so much of what I'm doing within PNHP, much of what our organization is preparing for 2028. We are laying the groundwork so that when 2028 happens, if we happen to nail a trifecta, right, where both houses of Congress as well as the executive swing to the opposite party that they are now, if we happen to have that again, what can we actually put in place? And we need that to be shovel ready, right? We don't need to sort of say on, January 21, 2029, all right, guys, we got what we wanted. Now what are we going to do? We need to actually have that system ready. So I think much of what I think about is, how do I organize people? How do I organize physicians? How do we build power so that when the political winds change, we can move in and actually fight for and achieve the system that we believe we deserve?
No, definitely. I hope that's what's going to happen because the current system, whether if you're a physician, a provider, I mean, even if you're a pharmacist, or even if you're working in the insurance industry, I mean, you may be seeing profits, but this is clearly not working. And if it were, we wouldn't be seeing the outcomes that we're seeing. We wouldn't be seeing patients struggling just to cut, like you said earlier, cut their insulin dose in half just so they can afford it. This has been a phenomenal episode. Just wanted to thank you so much for being here today and answering all of our questions. We really appreciate you, and we really want to see if we could have you again. This has been Connected by Health. We all, at the end of the day, have to understand that everything is connected, and unfortunately, a lot of it really affects our health. So thank you for listening, and thank you again, sir, for being here today with us.
No, it's been my pleasure. Thanks, Krishna.
If you found this conversation valuable, share it with someone who could use it. And if you're on Apple, we'd love to hear your favorite takeaway and a review. See you next week.